All right. Hello, everyone, and welcome to Nurses Lecture Room Live section. Hello, everyone, and welcome to Nurses Lecture Room. Yep, if you're watching this video, kindly drop on the comment section and let us know where you're watching from. I think today we are really starting early. Normally we start by 10, but today at least the kids slept on time and I wasn't really busy, and I decided to come live. So we have, I'm just going to call those that have, we have Fretty Cooper. How are you, ma'am? Doing great, Fretty Cooper. How are you doing? We have Kuda Peter. Kuda Peter said hi. Kuda Peter, how are you doing? Trust you're doing great. Gabriela Noye, how are you doing? Good evening. How are you doing? Trust you're doing great. We have Fred T. Cooper from Liberia. Fred T. Cooper, is nice having you on today's live section. Please, if you are watching this live, just drop on the comment section and let us know where you are watching from. And if you have any question, feel free to drop on the comment sections. We are ready to take your questions for you. So we have Lamine Usita from Sierra Leone. Nice having you, Lamine Usita. You are welcome to today's live. Then we have Patrick Momba. Patrick Momba, how are you doing? It's nice having you here. Noye said is from Lagos. Noye, thank you for joining our live. Sandra Essay. Sandra Essay, how are you doing? It's nice having you on our channel today. Kuda Peter from Zambia. Kuda Peter, is nice having you here today. If you have any question, feel free to drop on the comment sections. Like I earlier said, we'll be willing and ready to take the questions. So I think we are going to be spending longer on this live section today. So drop your question. Sandra Essay, I am waiting for your question. And if you have a friend or a colleague that you feel they have a lot of questions about their health, kindly share this particular video to them and let them join our live sections to drop their questions. And also feel free to copy the link and drop on your WhatsApp status, all your social medias. For those that have their questions, they can easily come and we will try as much as possible to provide wonderful answers for them. So we have Henry Samuel Pepra. Henry Samuel, how are you doing? Good evening, us. Good evening, Henry. How are you doing? Trust you are doing great. If you are coming across this channel for the first time, my name is Mercy Mary. I am a registered nurse midwife in Nigeria, but I'm currently practicing in the UK as a registered adult nurse. All right. So if you have any question, feel free to drop on the comment section. I am also a member of the UK YouTube Health. So drop your questions in the comment section and I am ready to take your questions. Okay. So Fretty says, my test is hot sometimes. Sometimes it can hurt on the left and sometimes it can hurt on both. Can it lead to infertility? In terms of testes being painful, there are different causes of painful testes. There are different reasons why one should experience, why one is likely going to experience painful testes. So it's not all pain in the testes that can lead to fertility. It's not all pain in the testes that can lead to fertility. Personally, my advice to you, Fretty Cooper, if you are having this like frequent testicular pain, I will advise you see the doctor to get it checked out. If there's anything that needs to be treated, they tend to treat it as soon as possible. All right. We can't say that, oh, you having testis pain can lead to infertility. No. Testis pain is rare. It's like it rarely leads to infertility. It all depends on the cause, actually. What is actually causing the testis pain? So the best thing I would advise you to do is to meet your doctor, get it examined, and share your concerns with the doctor. Let's see how it goes from there. If it's an infection that is causing that testis pain, the doctors might give you some antibiotics. They might give you some medications to help with that pain or to help with it. So that is my personal advice to you, Fertility Cooper. And I think I've made a video recently on the causes of pains in the testes. Did I? I think ball pain. Yeah, we made a video, a detailed video on the causes of ball pain, like testicular pain. So what I would advise you to do, Fred, is to watch that full video. At least that's going to give you an insight of what is causing that pain. So that's going to give you an insight of what is causing that pain. Fred, let me know if you get the answers to your question. So we have Henry Samuel said, I'm fine by the grace of God, and you please, I'm doing great. And if this is the first time of coming across this YouTube channel, my name is Mercy Mary. Feel free to subscribe to our YouTube channel, turn on the notification bell, just in case we pop up any video, so you'll be one of the first to get that video. Then also don't forget to double tap the screen, double tap your screen to actually like the video. Like I earlier said, if you have any question, drop in the comment section. Kuda Peter said, can the pain also cause prostate cancer? Prostate cancer and testicular pain are two different things entirely. Prostate cancer and testicular pain are two different things entirely. Testicular pain does not cause prostate cancer. Cancer is a different thing entirely from testicular pain. So what I advise you, if you are experiencing any pain in the testes, see the doctor. The testes are outside. The prostate is in a different location. All right, okay. So we have question from Noye. Please, I want to ask concerning the period calculation. I see on the 27th of June and 22nd of July. You saw, so we have a question from Noye. Noye said, please, I want to ask concerning the period calculation. I saw on the 27th of June and 22nd of July. Please help me and calculate. So what I would do is that I'll have to write the calendar. I've not, my calendar, my daughter has already scattered. So I will have to write another calendar here on the paper and see how I'm able to help to calculate it. Let me see if I can, but other questions can come in. I think I'm just going to answer the other questions that are just straightforward, so we don't keep others waiting while I'm drafting it, okay? Other questions that are straightforward, I will just answer it. So we have Promise John. Nurse Mary, good evening and happy blessed Sunday from Uromi, Edo State. Please, I don't know how can I chat with you one-on-one. If you want to book an appointment, all you have to do is send a message on Instagram and we'll send you a link on how to book an appointment. I'm from Edo State. Nice having you, Promise. I'm from Edo State, Nigeria, Promise. So we have Sandra S. says, my cycle is 31 days. When is my ovulation? I'm trying to get pregnant. So in terms, if you are 100% sure, Sandra, that you have calculated your cycle and it's 31 days, you are very, very sure that you have a 31-day cycle. So it's going to be 31 minus 14 days. 31 minus 14 should be 17. 31 minus 14 should be 17. So what you are going to do is to count the day you started seeing your menses. Count 16. I would say count 10 days. 10, 11 days from the day you started seeing your menses and have sex during that period, because that's likely going to be your fertile period. The day 17 should be your fertile period. So having sex like 6, 7 days before your fertile period, frequent and regular sex, might increase the chances of you conceiving, of you getting pregnant. Sandra S. says, that's clear, or you need me to go over it again? Harry Pepper said, please, how can one know that he is having prostate cancer? I think there are different signs of prostate cancer. Just give me a second. I've made a video on that. Let me see if I can get that video. I really want to explain this prostate cancer to you. Noye, sorry, because your question is not really direct, so that's why I want to explain what the prostate is, so that you will likely understand, so that it sticks better, the signs of prostate cancer. So for example, okay, So, how do I explain this prostate cancer now? How do I explain it? Okay, I'm going to explain prostate cancer and the sign. Let me tell you what prostate is for those that don't know about the prostate. For example, this is the pipe. Let's just say this is the pipe that urine pass through. So, prostate is like an organ surrounding that pipe. So, anything that affects that organ is going to affect the way you pass urine. Because if the prostate, as a result of cancer, is enlarged, it's not pressing on the pipe that carries fluid, it's going to affect your urination. So for people that are having prostate cancer, one of it is that they usually have frequent urination. They go to toilet frequently. That's also a sign, though frequent urination can be a sign of urinary tract infection. So another sign is difficulty starting or stopping urination. For example, now if you go to the toilet, you are able to start urinating and you are able to stop it, right? You might you don't want to even finish the urine in your bladder, you're able to stop it. But someone with prostate cancer is going to likely find it difficult to start, and is also going to find it difficult to stop urinating. It comes and go, like he's unable to control how the urine comes and how he's able to end it. So they usually have weak and uninterrupted urine flow. They feel feeling like the bladder is not empty. They usually feel, oh, there's something in the bladder, it's not empty. I've peed, but there's always something in the bladder. I've peed, there's something in the bladder. You get things like that. Then there's always sudden urge to urinate. You want to urinate frequently. That is there. There's erectile dysfunction can be there, unable to perform frequently, like, you know what I mean when I say erectile dysfunction, you're unable to meet up with the sexual desire. You don't last long. Let's put it that way. Erectile dysfunction. Then painful ejaculation. Whenever you want to ejaculate, it becomes really painful for you. You're experiencing pain. So if you experience pain while ejaculating alongside with these urination symptoms, that could be a sign of prostate cancer. Blood in the urine. So if you are passing urine and you are seeing blood in your urine, that is a sign of prostate cancer. If you are seeing blood in your semen, that's whenever you ejaculate, there's blood coming alongside with your semen. There's blood coming alongside with your urine. That could be a sign of prostate cancer. So might be experiencing bone pain, fatigue, swelling in the lower body. All these are signs of prostate cancer. Those last one I said, sometimes you might not see them. So it's not everybody that has prostate cancer at the very beginning that's going to see the blood in the urine or blood in the semen. But one thing that's very common is that urine, the way you pass your urine changes. You are going to the toilet frequently. You cannot control or stop urination. Like you feel that your bladder is full. Like you cannot empty it. So all these are little signs of cancer. If you look at it, some of these signs are similar to UTI. So you might be mistaking urinary tract infection for prostate cancer or prostate cancer for urinary tract infection. Generally, what I advise, if you are experiencing all these symptoms, please see the doctor. So that is that for the Harry. Let me know if your question is answered, Harry. Jos, just let me know if you're in the comment section. Let me answer your question. I think the backup P you are talking about is emergency contraceptive. Am I right? Jos, let me know if you're in the comment section so that I can answer your question. The backup P you are talking about, is it emergency contraceptive? Okay, Sam, we're glad your question has been answered. Feel free to double tap the screen to like the video. Feel free to double tap the screen to actually like the video. So we have Laminusita. Laminusita said, okay, Jos is in the comment section now. So Jos said that instructions on how to use backup P. And I believe the backup P she's trying to talk about is Postino 2. When it comes to Postino 2 is an emergency contraceptive. What Postino 2 does is that it prevents the egg from meeting the sperm. It makes sure that your egg is not released. It withholds the release of the egg. Your egg is already matured, it's ready to be released. But when you take Postino 2, it withholds it so that the egg is not released, so that fertilization does not take place, so that the sperm does not meet with the egg to actually form a baby. So in terms of taking post-P, it is advisable you take it within 72 hours after unprotected sex. Post-pill should be taken within 72 hours after unprotected sex. So the earlier you take it after unprotected sex, the better for you. So it is more effective when you take it within 24 hours. But generally, they advise like in general within 72 hours. So the earlier you take it, less than 24 hours, less than 48 hours, the better for you. So that's that. We've talked about the time duration now. There's something you should also know with post-P. If the egg in your body is already released, if you are already ovulating and you take Postino 2, it's not going to work. If you are already ovulating, you've already released the egg and you have sex, you're going to get pregnant, even if you take Postino 2. So that is why, as a lady, having an ideal of your cycle, having an ideal on when you are ovulating, when your body is releasing egg, is going to go a long way to create a balance. So if you are taking Postino 2 and your body has already released egg, that's when you hear cases of people saying, oh, I took Postino 2 and it did not work, I am pregnant. And if you are overweight, if you are obese, it is advisable you like, it might not work effectively well because you might need a higher dose. So what I would advise for people that are obese or they are having excess weight, I will advise obese or overweight, sorry. I will advise them to see the doctor when it comes to the use of post-P, when it comes to the use of Postino 2. Then what do I have to say in regards to post-P again? If you take Postino 2 and you vomit, like within 1 hour, within 30 minutes, you took it and you vomit immediately, I will advise you take another dose because it's out. It didn't get the opportunity to diffuse in your body before you threw up. Okay. And one thing you should know about backup pills is that they have a way of impacting your menses. It can make your menses come on time and it can make your menses late. So if you took Postino 2 and you're wondering why you've not seen your period, it could be because of the Postino 2 you've taken. That is why your period did not come on time. That is why your period came late. So Postino 2 can have an impact on your period. And I think that's something we should take note of. Postino 2 can cause little spotting. Some people like reports having spotting after using Postino 2. So if you take Postino 2 and you see a little bit of spotting, just know that it could be that Postino 2 that you took that caused that spotting. So I don't know if your question is clear, Jose. Do you have any question again outside that? I believe I've answered Joe's question. Just, I believe your question has answered. Just let me know if you get it before I go to the next question. Just, is your question answered, please? Just let me know if your question is answered. Okay, yeah, answered. Okay, glad it is answered. Sulema Koroma said, is prostate cancer curable? The answer is yes. Prostate cancer is curable if detected on time. Most cancers are treatable, most cancers are manageable, most cancers are curable when detected on time. That is why when you notice anything deviation from normal, when you notice anything strange from normal, it is advisable for you to consult your doctor as soon as possible. Most cancers are treatable, most cancers are manageable if detected on time. If not detected on time, when you now see the end stage, when it's not like it's getting worse, it's beyond repair. So that's where the problem comes in. But generally, most cancers are treatable. So, Koroma, let me know if you get that answer to your question. Laminito said, my sister wants to get pregnant. What are the remedies? The first remedy to getting pregnant is actually asking her if she has a regular cycle. If she has a regular cycle, the next thing that she has to do is to calculate her cycle, know her ovulation date. She should calculate her cycle, know her ovulation date, and that is going to increase her chances of getting pregnant by having sexual intercourse with her spouse on her ovulation day. So that is that for that. Henry Samuel Pepper. Okay, Henry Samuel Pepper, you have another question. You said, please, my wife has given birth for the past months and she's not getting her menstruation. And can she get pregnant? The answer is yes. Yes, she can get pregnant. So that is why breastfeeding, if she's breastfeeding, is not a surest form of family planning method. So if she has given birth, she has not seen her menses, she can't get pregnant because for menses to take place, ovulation has to take place. So if she ovulates before her first menses and you have sex with her before her first menses, that she was ovulating, you had something to do with her, you had sexual intercourse with her, she can get pregnant even if she has not seen her first menses. I don't know if that is clear, Pepper. Pepper, let me know if that question is clear. So I have Noye to answer, but I'm going to do a calendar for Noye. Pepper, let me know if your question is answered while I draft out this calendar. I think we've answered all the questions except Noye that needs like a cycle to be calculated. So I have to draft that calendar. That's why I had to keep her waiting. If you are watching this video, feel free to double tap and like the screen. And if you have any question, also drop your questions in the comment section. Drop your questions in the comment section while I draft out my calendar. Pepper, is your question answer, Pepper? So Joss has a question. Joss said, my friend's girlfriend refused protected sex and it's gonna be their first time. Any advice, please? If it's their first time, since it's your friend's girlfriend refused protected sex, so she wants unprotected sex. If she wants unprotected sex and it's gonna be her first time, this is my advice for her. One, if you can, use protected sex. If you don't want to use protected sex, then the second should be both parties should get themselves scrutinized. Like you go for lab test, both parties take blood samples just to be sure none of them has any STIs, none of them has any transmittable disease. So that's another thing. You have to be sure like everybody is clean, nobody has STIs, nobody has what they call it. Then if she's not ready to get pregnant, then being sure of her cycle and also be sure of her cycle and using the withdrawal method might also help. You get, it's a bit tricky. So that might also help to prevent pregnancy and use of emergency contraceptive. So generally, I would advise you as a young, if it's a young teenager or a young girl or a young youth or adult, whoever it is, what I would advise is that use protection when you're not sure of your partner's states. Harry Pepper, I am not clear with the answer. What's the question again? Sorry. Okay, Pepper, you said, I said yes, it is possible. It is possible for her to get pregnant because ovulation comes before menses. So generally, before she sees her menses, she has to ovulate. And ovulation is the time the egg is released. So if she ovulates for the first time and you had sex with her for the first time without knowing she's ovulating, she can get pregnant. So most women are lucky in such a way that they don't get pregnant, but others are not because they don't really know they were ovulating and they had sex with their partner and that resulted in pregnancy even before their first menses after childbirth. So it is possible for someone to get pregnant even if she has not seen her menses after childbirth. So am I clear somewhere? Is that clear for you somewhere? Somewhere, if it's clear, let me know. So Joy Bright said, what of those who have regular cycle and even know their ovulation, but still not pregnant. So in terms of that case, what I advise is to talk to your husband, to speak with a spouse, to actually go for semen analysis. Yes, speak with the spouse to go for semen analysis, because when they go for semen analysis, their sperm is being analyzed. They'll be able to know if there is a low sperm count issue. And if there's a low sperm count issues, they now have to think of, okay, what can we do to actually improve the sperm count? Sometimes it's not the woman's fault. It could be that the sperm count is low. It could be that the morphology of the sperm is what they are battling with. It could be that the woman has enough sperm, but the motility of the sperm are not moving. That can also affect the woman getting pregnant. So it's not just the woman. Both parties can go to the hospital and get things checked out. Not just the woman, but the man. And also, there's something called unexplained infertility. Unexplained infertility is a condition in which the man is okay, the woman is okay, but yet there is no pregnancy. In such a case, they advise both parties to keep trying or try other method of contraception. So I don't know if that is clear. Joy Bright, let me know in the comment section if you understand what I just explained. Joy Bright, let me know in the comment section if you understand what I just explained. So Ogbodo said, please, can I eat lots of pepper in my first trimester? So generally, like, you can, but generally it is seen that spicy food can cause contraction. Though there is no direct research in regards to that, but I think I also have that mindset growing up, and I've seen people who took a lot of spicy food during their first trimester. I've seen it experience a little bit of miscarriage, but there is no research in regards to it saying when you eat too much of pepper, it's going to affect your first trimester. So, but generally, I would advise you to eat in moderation, not too much pepper, so you don't just have unforeseen things that you're not planning for. And generally, having eaten a lot of spicy food during pregnancy can cause chest burn, can cause reflux. So that is why I will advise, in as much as you like spicy food, in as much as you like food filled with pepper, try and eat it in moderation. Try and reduce it. It's going to go a long way to help you. Ogbodo, let me know if that helps, if your question is answered. So Pipra said, very clear, madam, thank you. So Laminatu said she always sees her period on the 16th. What is her menstrual cycle? So Laminu, you have to tell me the exact dates. I don't think it's possible for her to be seeing it every 16, 16, 16. You have to tell me the exact dates. In July, did she see it on the 16th? In June, did she see it on the 16th? You have to be certain of the figure for us to cycle it in the calendar, and from there, we are able to go about it. So Jos M says, some info about masturbation. My friend is struggling with it. In terms of masturbation, I think I've made a video on how to cut down on masturbation. So masturbation can be an addiction. One can be addicted to it. It's not just masturbation. One can be addicted to masturbation. They can be addicted to pornography. Same way you get alcoholic addiction. People are addicted to smoking. That's the same way you get addiction to masturbation. So what I would advise in that sense is, first of all, have it in mind that you want to stop. Then there should be a reason why you want to stop. Because if you want to do something and there's a reason for you want to do what, like there's a reason you are holding on to why you are doing that particular thing, it's going to make you quit. It's going to make you reduce it. So if you don't have a reason, for example, you set goals and you don't have a reason why you want to achieve that goal, you are not going to achieve it. So, I want to charge my phone. Why? I'm charging my phone so that I have enough battery to do this live section. So nobody needs to remind me to charge my phone. So one thing I advise you, the first and most important thing I'll advise you to do is have a reason for what you are doing. Have a reason why you are doing this particular thing. So when you have the reason, the next thing is to remove everything that will stimulate you to do it. For example, if you are having a lot of pornographies on your phone, the best thing is to delete them. The first thing is to actually delete this pornography on your phone. If you're having any access to the website, delete them. If the people you are following, the WhatsApp status, is looking sexual, is looking arousing to you, unblock them. Block them, I mean. Mute their status. You don't want to see them. Or block them. You tell them, oh, I don't want to see your status. Please, sorry, because I don't. Block them. If the social media you're following, it could be Facebook, it could be Instagram, anybody you're following that posts something like that keeps you aroused, take them out. Any distraction at all. If you have magazines that keep you aroused, that you usually buy, take them out. So any distraction around you, that anytime you see this particular thing, it stimulates you to want to masturbate, take them out. Because when they're out, at least it reduces it a bit. Then the other thing is to find something. It could be a hobby. What do you like doing after masturbating? Outside masturbating. What do you like doing outside watching pornography or masturbating? There's something you should like doing. Maybe you like riding a bicycle. Maybe you like going to the park. Just pick out one thing that you like doing. When the urge comes, try. I know it's easier said than done. Try as much as possible to divert that energy that you're supposed to use for it, to do that particular thing that you enjoy doing, like the hobby you want to do. So this doesn't just apply for masturbation alone. It applies for things that you're addicted to and you're trying to leave. So look for something to replace that action. And if you can, get an accountability partner. Oh, get an accountability partner, somebody you like that should hold you accountable if you break the rules. All right. And there's something I also want to say. I might not expect you to stop it totally. It's going to take time. So if you used to do it like 2 times a week, or let's just say 2 times a day, the first thing is to bring it down to 1 times a day. Be conscious as much as you can. If you used to do it like 5 times a week, then bring it down to 3 times a week. Go to 1 times a week. So it's going to take a gradual process. As you are going along the line, you will fall again. But falling again while trying to live a particular thing does not make you a failure. When you fall again, tell yourself you are human. Then stand up and try not to fall again. So I think that is going to go a long way, getting an accountability partner. Personally, I am not a sex therapist and neither am I a psychotherapist, but this is just my personal opinion to help guide you out. So, and I hope that helps for that particular person that you said. Obodo said, all right, all test results are fine. Yes, I understand. You're welcome. I wish you all the very best. So keep trying since all the test results are fine. Hopefully one day something comes out. There's something called unexplained infertility. It's a type of infertility that they don't really know what is actually causing it. So we have Harry says, do you have a TikTok account for me to follow you? Yes, I have a TikTok account and it's Nurses Lecture Room. Though I'm not really active on the TikTok account, but you can follow me. Maybe if I see the following growing, it might motivate me to be active on TikTok. For now, I'm just active on my YouTube channel. So that's that. So Noye, are you back? Noye, I'm supposed to calculate Noye's cycle. No, let me know if you're still here. If you have any question, feel free to drop on the comment section. Is Noye here? Do we have any question, please? 30 days. Okay, please drop the start date in the comment section, Oye, so that I can do it now. Drop the start date in your comment section. Noye, please drop the start date of your measles in the comment section. You said, I think you gave me dates for June and July. Can you drop it? I didn't get your other question. Sometimes if your question actually goes against YouTube policy, it might not appear on the comment section. Noye, please drop the start date. Let me just answer this question, Noye. I'm sorry, Noye, but I've done the calendar now. The calendar is ready, Noye. Danso TV channel said, good evening, ma. Please, there's something I don't understand. My wife is having pregnant signs, but she's seeing her period and her stomach is getting big. Please, what can be the problem? It's not a situation. If she's having pregnancy symptoms, what I would advise her to do is to do a pregnancy test. Yes, she should do a pregnancy test. And if nothing is showing, she should go and see the doctor. You said her stomach is getting bigger compared to what she was before, and she's seeing her period. She's seeing her period is there's a higher chance that she's not pregnant. For she to see her period, there's a higher chance that she's not pregnant. So I will advise her to see the doctor because you said her tummy is getting bigger and she's experiencing pregnancy symptoms. So what I would advise her is to see a doctor. Probably the doctors might say she should go for a scan just to confirm that everything is fine. So that is my personal advice for you, Danso, and I hope that helps. Yeah, I heard it. I think my husband told me. England are world champions. Congratulations to England. Yeah, congratulations. Gabriel's okay. So Gabriel, we're going to calculate Gabriel's cycle, but she didn't. Normally, we need at least 3. So normally we need at least 3 start dates, probably May, June, and July. To be more accurate, May, June, and July. But since you just gave us June and July, we're just going to use it to create an estimate. All right. We're supposed to have at least 3 start dates. So June started June 27. June 27. July is 31st. Then July started on the 25th. So what's going to happen to calculate it? We're going to count how many days, with 27 being our day 1, 28 2, day 2, 29 day 3, 30 day 4. That's how we calculate it to 24th of July. So that's going to give us the days interval from June 27 to 24th of July. So, sorry, 21st, sorry. So 21st of July. June 27 to 21st of July. So that's the days interval we're going to be calculating. Because the one in June started on the 27th, and the one in July started on the 22nd. To actually get an accurate cycle, you have to start counting from June 27 to a day before the other period, which is 21st. So if we have to count it, we have 21, 22, 23, 24, 25. From it, it shows that you have 25-day cycle. But we cannot predict with this because, like I earlier said, we need at least 3 start dates. So, but let's just assume it's 25-day cycle. So if it is 25-day cycle, your ovulation period is likely going to be day 11. So 11 days from the day you saw your period is actually the day you are raising egg. If your cycle is not fluctuating, if it's usually 25 days, 11 days from like day 1, whenever you start your period. For example, today I see my period, that's day 1. So you are going to count 11 days from that day you started seeing your period. And that's going to give you your ovulation, plus or minus 2. So Gabriel Noye, is that clear? Gabriel Noye, is that clear? Isa Zachary said, hello, good evening, 2 days. Yeah, I have not been live for 2 days. Yes. I have not been live. I was choked up. I've not been live for 2 days. I was choked up with a lot of activities within these 2 days. It was really a lot for me. I was supposed to use today to rest because day first day and yesterday was quite busy for me. Yeah, so that's why I didn't come online. But I said, no. I've been offline for 2 days, which is not supposed to be so, but let me just come online. So that was why I came online today. So I was supposed to rest today. I had to get my hair washed out. I had to get myself sorted out. So it was a whole busy 2 days for me. So Noye, is that clear? Noye, if it's clear, let me know. Okay, Noye said it's clear. So what I would advise you to be more accurate, Noye, take note of your August measures so that we are more accurate. Take note of your August menstrual cycle. take note of your August measures. So that's going to make us more accurate. So Patrick Mumba said, the manhood erects strongly. Just when inserting, it goes flat and never to erect again. What can lead to that? It could be a case of erectile dysfunction, and there are different causes of erectile dysfunction. You can't really pinpoint this particular thing and say it's a cause of erectile dysfunction. There are different causes of the erectile dysfunction. So I think you have to analyze the cause and see which one actually suits, which one is actually causing your own erectile dysfunction. In our previous video, I have also said that aside medical reasons for erectile dysfunction, there are also psychological reasons that can actually cause erectile dysfunction. And that's something we have to look out for. The psychological reasons where we're talking about, are you stressed out? Are you having anxiety? Are you depressed? Is your relationship with your partner good? Are you people like having a wonderful relationship, or there's always quarrel, there's always conflict here and there? So all these psychological reasons, all these emotional reasons can actually cause erectile dysfunction in another in an aspect. Then medical reasons is also there. So we have to actually know the cause to be able to know the solution to it. Patrick, is that clear, please? Patrick, let me know if that's clear. Okay, Patrick Mumba said yes. Gabriel Noye said yes. Okay, that's good. So, Patrick, I think you should first of all look at the psychological aspect first. I think you should look at the psychological aspect, check your relationship with your partner. Are you having double thoughts? I think you have to look at that too. Because some of these things are as a result of some psychological aspect, like I earlier said. So, but sometimes we overlook it. We don't really take it into consideration. All right, I think we've done a lot. We are still doing a lot. So if you're watching this live section and you've not double tapped to like the particular video, I will appreciate if you double tap the screen. Once you double tap the screen twice, it automatically likes. Just tap on the screen twice and it automatically likes the video. And also don't forget to subscribe to our YouTube channel. Yeah, if you've not subscribed, if this is the first time of coming across this channel, I will also advise you subscribe to this YouTube channel because we are anticipating a lot. And also I might reduce my coming live. I don't know how frequent it might be. So we might do more of videos rather than live sections soon. So it's going to vary. So what I advise is for you to subscribe, turn on the notification bell. So whenever we upload the video, you are one of the first people that tend to see the video and watch and drop your wonderful comments. Because if you've checked our channel so far, we have interesting, engaging content on our YouTube channel, which are very, very important and beneficial to your health, especially your sexual and reproductive health. So it's very, very important. So feel free to drop your question. I am also here. Zachary, thanks for joining. Zachary, thanks for joining our live. I think normally we're supposed to start our live by 9:10. So 9:10, but we've started earlier than we normally do. Do we have any question? Okay, official alarm, they said, I've been suffering from sinus infection since past 3 years, taking all kinds of medication, but still yet, I believe still yet, you are not seeing any improvement. So when it comes to sinus infection, I may not have a broader knowledge in regards to that. I don't have a broader knowledge in regards to sinus infection. What is my advice? You've gone to see the doctor. Let the doctor know this is your concern. Yeah. If they've been giving you medications and it's not working, go back to the doctor and let them know. While on those medications, while taking those medications, eating healthy is the key. Eating healthy is the key. Adding a lot of herbs to your food is going to go a long way to help. Your ginger, your garlic, your turmeric, your cinnamon, your curry powder, your rosemary leaf, like all these herbs, they play a role in having a healthy life. So I will advise inculcating herbs into your diet for healthy living, because all those things help generally with your overall well-being and your overall health. Why I will still advise you keep seeing a doctor and asking for proper medications from your doctor and prescriptions from your doctor, because I believe a specialty in that sinus infection, that's what you are seeing. A doctor that has a better knowledge on it, that's what you are saying. So I cannot say anything um about sinus infection. So this is my personal advice: continue with your medications, maintain a healthy living, maintain a healthy lifestyle, avoid unnecessary caffeinated drinks, avoid processed food, just maintain a healthy lifestyle, eat healthy as much as you can, because that is going to go a long way to help your general body immune system and your body generally. Because when you have a strong immune system, your body is able to fight infections that come, your body is able to fight diseases that come. So that is why eating healthy, eating food that helps to boost your immune system, it's very important. I can never overemphasize the benefit of eating healthy when it comes to building your overall body immune system and building a healthy life. So that's my advice for you, Olamide, and I hope that helps. So Henry said, please, my network went off. Please, do you have any TikTok account for me to follow? Yes. Like I said, I have a TikTok account. It's Nurses Lecture Room, but I am not that active on the TikTok page. Hopefully, when you people follow me on TikTok, I might become active on TikTok too. But I'm more active on my Facebook page for the now. So please, I'm having a serious waist pain and I've been taking medications, but still, can you please help me with that? I am not a pain therapy, but this is my advice when it comes to pain. You said you've been taking medications. First thing, what work are you doing? What's your job description? Does your job descriptions involve bending your waist, sitting for too long, standing for too long? What is your job description? How old are you? Because the more you get old, the more you are being predisposed to having this kind of pain. So the first question is, what job are you doing? Are you bending too much? Are you standing too much? Are you sitting too much? Then also, if you know you are standing too much, sitting too much, or bending too much, whenever you have the opportunity, exercising is going to go a long way to help. Get regular exercise daily is going to go a long way to help with those pains sometimes. Because if you are sitting for too long, you just tend to put a strain on that your back area, causing that pain. So exercise is going to go a long way to help. Massages are going to go a long way to help. You can even if you don't have money to go for the expensive spas and all the massage, you can do a home massage with your partner helping out to massage the waist properly. So that can go a long way to also help while taking your prescribed medications from your doctor. So that's what I have to say, Pepra, and I hope that helps. If you have any question, feel free to drop on the comment section. Sandra Essay, I thought you've asked the question. Has it been answered? Okay, Pepra said yes, please. You're welcome. Okay, Sandra, let me know okay, if it has been answered. If you have another question, feel free to drop on the comment section. You can send me a message on TikTok. I don't think the phone number is asked, but you send me a message on Instagram if you have something private to talk about. So if you have any question, feel free to drop on the comment section before the live ends. What is this? Okay. Do we have any question, please? If you have any question, feel free to drop on the comment section. So we've spent 52 minutes on this live. I think the live, the live might be ending in next 8 minutes. If you're watching this live and you're almost leaving, what I advise you to do, please double tap the screen to like the video. Double tap the screen to actually like the video. That's going to go a long way to help. I'm trying to see if I can reply some comments while I'm doing this. Let's keep all the questions coming. Okay, let me see. Okay, Harry said, today is my first time joining and I have learned a lot. God richly bless you and keep you safe for us. Amen. Harry, don't forget to subscribe to our YouTube channel and turn on the notification bell. And also, don't forget to also check our previous videos on our YouTube channel. Trust me, you're going to learn a lot from our videos. So don't forget to click on the subscribe button, like, subscribe, and share. Good night, Patrick. Good night, Patrick. Thank you for joining our live. The live will be ending soon, so drop on the comment section if you have any question before we go. Thank you very much. And also don't forget to double tap the screen to like the video. So do we have any questions left today? For those that are wanting to calculate their cycle, you still have 5 minutes to get that sorted out for you. If you want to calculate your cycle, you want to know your ovulation date, you still have 5 minutes to get that sorted out for you. So are we done for tonight? Are we done for tonight? So what I'm going to do now when the live ends is to go to the comment section and answer some of the questions before I do it. So the live sections is going to be ending soon. It's going to be ending. Okay, we have from Dansu. Thank you so much. I've been following you for more than 1 year, ma. Allah bless you and give you long life and health and happiness in life. Amen. Thank you very much for the prayers, Dansu. I really appreciate your prayers, Dansu. I'm glad. That's a long time subscriber. For 1 year, it's been a long time. Thank you very much. For those that have not subscribed, do well to subscribe to our YouTube channel. Do well to turn on the notification bell so you don't miss out whenever we pop a new video. And also, if you've not double tapped to like this particular live section, all you have to do is double tap the screen. Just double tap on the screen and it automatically likes the video. Double tap the screen and it automatically likes the video. All right. So remember our live sessions is usually 1 hour. So we're going to end the live now. Thank you all for joining our live sections. Thank you all for watching the video. We really do appreciate your presence. We really do appreciate you joining our live section. So we're going to be seeing you hopefully tomorrow in another live section. Bye everyone, and see you in our next live video.